Welcome friends. Are you a pharmacist? Can you open pharma clinic to diagnose the disease or can you prescribe the medicine? One news came to my notice that pharmacists can prescribe medicine as per Pharmacy Practice Regulation 2015. But later on it was clarified that the news is not rightly explained, or you can say it's a fake news, and withdrawn. What is Pharmacy Practice Regulation 2015? What kind of benefit pharmacists may get from it? In this video, I will discuss all about this Pharmacy Practice Regulation and its amendments. Are pharmacists empowered under PPR 2015 to open pharma clinics to diagnose the disease, or can they prescribe medicine? To know the answer, you may please continue this video without any skip. Pharmacy Practice Regulation 2015 was first notified on 16th January 2015 in the Gazette, and then first amendment published in the official Gazette on 30th June 2021. In this first amendment, the duty of drug information pharmacist in drug information center, in hospital, and qualification and skill of clinical pharmacist were included. In the second amendment published in the Gazette on 1st February 2022, whereas qualification and skill of clinical pharmacist are modified and M.Pharm in clinical pharmacy is included along with Pharm.D. In the latest notification dated on 17th October 2022, Pharmacy Council of India has directed all the state and union territory governments and state pharmacy councils to take steps to immediately implement the Pharmacy Practice Regulation 2015 notified earlier by the Council in January 2015. Clarification on Pharmacy Practice Regulation 2015 notified by Pharmacy Council of India in Gazette of India number 17 date 16th January 2015. This is in reference to various messages being circulated on social media, email, WhatsApp, etc. that pharmacists are empowered under Pharmacy Practice Regulations to open pharma clinics to diagnose the disease and prescribe medicines. In this connection, it is clarified that there is no such provision in the Pharmacy Practice Regulation 2015. Under the said regulations, the registered pharmacist is required to dispense medicines on the prescription of a registered medical practitioner and can counsel the patient or caregiver on medicine to enhance or optimize drug therapy. The elements of patient counseling may include the following, which I will discuss in the next slide. The elements of patient counseling may include: number 1, providing information on the name and description of the drugs. Number 2, the type of dosage form. Number 3, dose of the medicine. Number 4, desirable route of administration. Number 5, duration of drug therapy. Number 6, intended use of the drug and expected action, and special direction and precautions for the drug. And last one is common side effects or adverse effect or interaction and therapeutic contraindications that may be encountered, including their avoidance and the action required if they happen. The elements of patient counseling may also include techniques for self-monitoring drug therapy, proper storage of drugs, prescription refill information, action to be taken in the event of a misdose, and ensuring rational use of drugs. In view of the above, it is again clarified that Under no circumstances the registered pharmacist is empowered under Pharmacy Act or and Pharmacy Practice Regulation to practice medicine or open clinics to provide medical care. So now it is clear that pharmacist cannot prescribe medicine. The said pharmacy practice regulations lays out norms including number 1, the code of pharmacy ethics, number 2, duties and responsibilities of registered pharmacist, number 3, maintaining good pharmacy practices, number 4, maintenance of patient records, number 5, the duties of registered pharmacist to their patients, number 6, promotion of rational drug use, number 7, the definition of unethical acts, number 8, punishment and disciplinary action in case of violation of the conduct, and the last, the regulation also details how the pharmacist can provide patient counseling. Under the regulation, a registered pharmacist is required to dispense medicines on the prescription of a registered medical practitioner and can counsel the patient or caregiver on medicine to enhance or optimize drug therapy. Key points of Pharmacy Practice Regulations 2015. Number 1. The new Pharmacy Practice Regulations 2015 was enforced by PCI to regulate pharmacy practice in India. Number 2. As per the rules, dispensing of drugs should be carried out by the qualified registered pharmacist only. Number 3. Renting of registration certificate to pharmacy owners are strictly prohibited. Number 4. The pharmacist who rented their registration certificates without attending dispensing services considered as misconduct and subjected for cancellation of their registration certificates permanently. Number 5. The pharmacist during working time should wear a white clean apron with a black badge consisting of name and registration number of the pharmacist. Number 6. The registration certificate should be displayed visible to the public. Number 7. Along with dispensing services, pharmacists should provide their professional services like patient counseling, adverse drug reaction reporting, and primary care to all uncomplicated simple illness. For this purpose, a separate cell should be arranged within the pharmacy. Point number 8. Pharmacists may charge consultation fees for their professional services. Point number 9. If any case of drugs dispensing carried out by an unqualified person instead of qualified pharmacist, public may lodge their complaints against pharmacist directly to the registered state or central pharmacy council under section 14b of chapter 9 of Pharmacy Practice Regulation 2015 for violation of the section 42 of Pharmacy Act 1948. Section 42 of Pharmacy Act 1948 is already discussed in my previous video topic Good Pharmacy Practice. As you know, as per this section, no person other than a registered pharmacist shall compound, prepare or mix or dispense any medicine on the prescription of a medical practitioner, and whoever contravene the provision of subsection 1 shall be punishable up to 6 months imprisonment or fine of 1000 rupees or with both. Please comment your views on Pharmacy Practice Regulation 2015